who's live streaming us as well. This is the first, hopefully, of more panel discussions that are going to focus on men's mental health in this province, hosted by NAPE, of course, so thank you very, very much for that. June is Men's Mental Health Awareness Month, so it is a month to talk about this, but these are conversations that hopefully we're going to have throughout the year as well, not just on a month, right? I'm very happy to be part of this conversation today, but let me introduce my panel first. Joining me is, of course, a face you're going to recognize here at NAPE, Jerry Earle, president of NAPE since 2015. He is the longest-serving president, in fact, of the union. He began his healthcare career at the former General Hospital as a certified nursing assistant. He went on to serve in a variety of frontline healthcare roles, including an LPN and a paramedic. You have drawn on frontline healthcare experience now for years and has witnessed firsthand the profound impact that mental health injuries can have on workers, their families, and on their communities too. We're going to talk about that a lot today over the next hour or so. He is a passionate advocate for mental health awareness with a particular focus on the unique challenges that men face when it comes to talking about mental health. Please welcome Jerry Earle. Also joining me is Nathan Jenkins. He is a certified Canadian counselor. Nathan has worked in the mental health field for the past 3 years, supporting people as they build resilience, develop healthy coping strategies, and improving their overall well-being. Through the Men's Mental Health Network, he is committed to increasing access to mental health education, fostering meaningful conversations, like I hope today will be, and helping men really develop skills and confidence needed to support their mental wellness. He works with individuals, workplaces, community organizations, and partners across the province to promote mental health literacy, to reduce stigma, and strengthen community connections. Please welcome Nathan Jenkins to the stage. Last, certainly not least, we have Bill Jeffrey. Bill is a Canadian certified counselor, a men's mental health advocate, and a community leader dedicated to advancing conversations around men's mental health, around loneliness, and social connection. He is the founder of the Lonely Man Project. That's a grassroots initiative that's become really a recognized voice for men's mental health in Newfoundland and Labrador. He also wrote a song called The Lonely Man, which we're going to hear at the end of this conversation, a song about the often unspoken experiences of loneliness, emotional struggle, and isolation faced by many men in Newfoundland and Labrador. Again, focuses on what today's conversation is going to be about, too. In addition to his counseling practice, Bill serves as a project coordinator with Men's Shed Newfoundland and Labrador, supporting the development of programs and community spaces that bring men together through shared activities and peer connection. And he really focuses on reducing the stigma around mental health challenges. Please welcome Bill Jeffrey to the stage, too. That's not the full bio, by the way, for any of my guests here, but we only have an hour, right? So I do want to start, though, by maybe getting to know you all a little bit more. And Jerry, I'm going to start with you here. Mental health, specifically men's mental health, is a passion of yours. Why?
I'll tell you why, and probably a little bit difficult, but my first email this morning at 6:45 a.m. And there's why I'm passionate about it. Jerry, unfortunately, sad news yesterday of one of our members passing this weekend. Also, we found out he took his own life. I worked with him on Friday night, and he was so pleased with a new agreement because we just negotiated a new collective agreement and couldn't stop thanking me how much this job had changed his life. I never got much sleep last night, and it was not a fun place at work today. He loved his union. He loved his job. He had other issues that he covered up very good. I had such a good conversation with him Friday, and he seemed everything was looking up for the future. It's because I hear those stories so often from our members. These reach outs so often that we need to be able, at least take steps to change what's happening in many workplaces, especially those we represent, but in any workplace, and what's specifically happening to men in many of the workplaces.
Yeah. Thank you for sharing that, by the way. Certainly not the only email like that you've gotten. And I do want to say right now, if anybody is here in person or is watching on the live stream, we are going to be talking about some really sensitive topics. We're going to be talking about issues of suicide and things like that, too. So I just want you to be aware of the conversation we are going to be having today. And we will, at the end, talk about supports that we can avail of in this province to make sure that if you are, or if you know somebody who is having problems right now in terms of their mental health, that they can seek some answers today. Okay? Nathan, as a counselor and with the Men's Health Network, what drives you to do this?
Well, I recently started with the Canadian Mental Health Association as the Men's Mental Health Program Coordinator. And that is a real passion of mine. I mean, as I get older, my connection with my friends are still strong, but I know not many men have those same connections. I mean, recently I was celebrating one of my friends' events. He was, preparing for an important time in his life, and we don't often share very intimate emotional moments with each other. We're just get out with the boys, have a good time, and all the emotional stuff go to the wayside. But that night we actually created space for each other, and I, one of my friends, he learned that he has a medical condition, and he was in tears. And if we didn't give him space that night to talk about it and open up conversation, he may have kept that to himself and his fiance for a very long time.
Yeah.
And this is why creating space and having these conversations and creating awareness around men's mental health is so important, because we need to start opening up about what's happening in our lives.
Yeah, absolutely. Bill, the motivation behind the advocacy you do and the founding of the Lonely Man Project, what was the motivation there?
Well, for me, part of it is professional, part of it's personal. I've seen the impact that loneliness and stress and mental health challenges can have through my work and also through lived experience. That's why I started the Lonely Man Project. I talk to a lot of men. You talk to them and you listen to them, and you realize how many of them are trying to carry such a weight on their own, and that you're actually not alone as you go through it.
Yeah.
And for me, trying to create some belonging and some purpose and some connection for men is something I'm just very passionate about as a solution.
I mean, it's a thing that every one of us has been touched by at some point. Whether we know it or not, there's somebody in our lives who is likely struggling or not even aware that they are struggling with their mental health, right? Which leads me to, I guess my first question is to sort of get a little bit of context here, is how literate are we, men specifically, in this province when it comes to mental health, its determinants, and all of the supports that are available? Nathan, how literate are we?
Well, when it comes to men's mental health specifically, I guess I think of depression. Depression, we're sad, we're isolating ourselves, we're withdrawing from other people. Isolation can really impact our well-being and our mental health, and even our sense of self-confidence. One of the literacies when it comes to men's mental health is men tend to externalize a lot of their symptoms when it comes to depression. They may use alcohol more, they may become more irritated and upset with others, and kind of, I guess, that literacy is essentially trying to push people away because we're trying to keep it to ourselves, and we're in our own mind for a very long time without opening up and being vulnerable with other people. And really, we have to create space like this so men can be vulnerable.
Yeah. I want to talk a little bit more about that in a couple of minutes, talking about how it manifests in men and sometimes the confusion that can happen in terms of attending to and understanding the symptoms that men might be having right now. Bill, I do want to talk a little bit about the word crisis. We do love a good soundbite. I'm a journalist. We love a good headline too. I totally. Are we in a mental health crisis in this province in terms of men's mental health, or are we on the verge of one?
I think it depends what you mean by crisis. Right? If we're saying all men are, going through life and they're battling a mental illness, no, not really. If we look at it, most men are getting up every morning, they're going to work, right? They're paying the bills, they're doing what they need to do. If we look at crisis as being the number of men that are suffering quietly, that are trying to push through, that are trying to handle things on their own, trying to be an island. A number of guys that don't come in to get any help until they absolutely have to, if even then. A number of guys that are impacted by traditional masculinity, right? Basically acting exactly how they were raised and taught to be, to handle their own business, to be dominant and competitive, to not lean on each other, to be very stoic, then we're absolutely in a crisis. Men and boys are in a crisis in our province, and they have been for quite a while. The problem is there's a big gap between I'm fine and crisis. A lot of men fall in the middle, and because they're falling in the middle, they're not getting the support that they need. We're not recognizing it. They're not recognizing it. We don't have the supports in place to help them. When we look at crisis, you look at mental health, a lot of guys come in and, they don't recognize what's going on, right? We talk about mental health and we talk about the determinants of mental health. We need to start including loneliness, connection, and belonging in those conversations as well, right? So it's a loaded question, right? Because if you say, no, we're not in crisis, well, do we need to put more money into, we need to put any more supports in here? But when you broaden the definition of what crisis means, and when it comes to men and men and boys specifically, we have a huge problem here in our province, and different societal indicators, much like the suicide rate, domestic violence, these other indicators are all highlighting that for us.
I asked that question, and I used the word crisis to lead into my next question, and that is we often seem to talk in extremes when it comes to mental health. So you're either going to have somebody who you say, I'm fine, I'm great, nothing to see here, nothing's wrong, or I need immediate help right now, or the worst case scenario is Jerry gets an email like he had this morning, for example. When it comes to physical and social isolation factoring into that conversation like you just mentioned there, how do we make sure that we're not meeting men and young people too in that crisis state where they need the immediate help? How do we do determinants, for example, isolation, before they get to that part where they need immediate, emergent help?
Yeah, and that's a big issue. Like we've got some resources out there. They're available to men. They're not designed for men. Right? We haven't designed the services that we need to engage men to come in to help. What we've realized is that men engage differently, they communicate differently, they present differently, right? They connect differently. And we've set up a system that doesn't meet their needs. And so we haven't asked the question of, I think it's like 67% of men haven't sought mental health support. So if you look at a system and you say, well, you know what, only about a third of the people are using this. We've got a 80% male suicide rate. We got domestic violence rates off the charts. We've got all these societal indicators, and only 1/3 of the men are using the mental health supports that are available. And instead of saying, are we designing these for our target audience? Are we meeting men where they are? Or are we telling them they need to try harder? All right, so we need to have a real good conversation and a real good look at our system to see how do we engage men to come into these systems and have different entry points for them to come in, because the system is not working. It's failing men and boys, and honestly, we need to do a whole lot better.
There's a disconnect there. I mean, you talked there about, I'm looking at a Canadian Men's Health Foundation survey from April of 2025. 2,000 men over the age of 19 were surveyed. It said 50% were at risk of social isolation associated with higher stress and risk of depression. Yet, like you mentioned, 67% reported never having ever sought out mental health supports and services. Jerry, where is the disconnect here?
I think the disconnect is, and really what Bill alludes to, I sometimes go over and look on the medical side. We get into specialized areas where we recognize there's an issue. When we go to the mental health side, we don't recognize there is a significant issue around mental health and how it affects men. And I don't think, and sometimes when you even talk about it, the disconnect doesn't exist. There's no specialist looking at this. Unfortunately, statistics is there, but we don't only see the statistics, we are seeing the impact on it. We are seeing the families, we are talking to the members, and And like I said, significant disconnect.
And let's be clear, whenever we talk about statistics and surveys, we're only looking at the people who were motivated enough to answer a survey and to answer those questions. We're not looking at the people who are maybe not even aware that they have an issue to talk about or who are not ready to have that conversation, right? Nathan, is part of the conversation, or part of the issue, I should say, the fact that men have a harder time identifying the feelings that they are feeling at this point, and even understanding that they might have a problem when it comes to their mental health? Like, what do you see in your practice right now?
Yeah, I guess someone actually brought to me an interesting analogy that, early in life, we all have a box of crayons, like the 64 pack, and each of those crayons represent an emotion. And, we try to experience each emotion, but as like young boys, teenagers, men, sometimes when we experience an emotion, we get told, suck it up. You can't be sad. That's a sign of weakness. So that crayon comes out of that box. And then eventually that box just becomes an 8-pack. So somebody is trying to speak with us with like a turquoise crayon. I just got blue and green. It's like we're trying to speak on different wavelengths about emotions. So even like understanding the emotion that we're experiencing is really hard, or like blended in a sense, like two colors, like sadness and fear can blend together really easily. And I guess anger and frustration is often the emotion that we outwardly express because it's comfortable. It's a protective emotion, but we're not looking underneath to see what is fueling that anger. Am I insecure about this? Am I afraid? Am I sad? Am I even just hungry? Hangry is a thing.
I know that feeling all too well. Bill, you and I had a chat before we started this discussion, and the word "fine" popped up. And it's one of those words that just kind of makes me twitch a little bit whenever we talk about mental health, because we have a tendency to be like, oh, no, I'm fine, I'm good. Because I don't know if people really want to hear the answer to how I'm really feeling right now, for example. How often do you hear that in your practice? And yet somehow then, when you dig a little bit deeper, you're realizing, oh, no, you're not fine at all, really. There's a whole host of things that they've listed that they might not even be aware of. How often do you hear that?
I hear it all the time. I get clients that'll come in and their girlfriend or their mom or their wife might have contacted me and say, "Hey, can you see my son, brother, whatever it was?" And I'll contact them and have a session. And the number of times I'll hear a guy come in and say, "So how you doing?" "Oh, I'm fine." And I'll stop and I'll say, "Oh, okay, because your wife contacted me to see if I'd have a session with you." And he'll kind of tense up a little bit and sit back and say, "Well, yeah, she said if I don't find some counseling, then the marriage is over." Oh, and that's fine to you, right? So what would a crisis look like if that's fine, right? So for men, fine is the bucket that we throw everything in. We're always fine, right? There's a number of different reasons. Like you talk about disconnection. The disconnect coming with seeking help. Society has created that. Right, the way we socialized our young boys and still do to a great extent is that they need to be strong and competitive and dominant, right? They can't ask for help. So it's not that, you see the number like 67% haven't reached out for and used mental health services. It's not like men are saying my mental health isn't important. And it's not like they're saying, I'm going to avoid getting help, right? They are literally trying to do it themselves because since they're that high, they've been told that they handle their own business and anything else is a weakness and a failure. Right? That's where a lot of this disconnection comes from. So, they'll seek help when they find themselves in crisis. The marriage is blowing up. I lost my job. I'm addicted. I'm an alcoholic. I've had a domestic violence incident, right? Something like that. Not before. And a main reason for the disconnection is the way that we've socialized them. They're doing exactly as we taught them to do, which is handle your own business. Right? Anything else is failure. And that's the messaging that we need to change for the men that we have now and for the younger generation, because guess who they're watching and emulating?
That's a hard message,
It's
right?
a hard message.
Because pull up your phone or you go on social media and all you see is this ideal of what a successful man is, and they're muscular, they're tan, they probably have tattoos, and they own their own business, and they're in control of everything, and they drive a flashy car. They don't talk about their feelings. They don't have a bad day. They're definitely not a turquoise crayon, right? How do you then get past that? Because we are constantly on social media, and oftentimes that messaging is all soaking in subconsciously as well. Jerry, where do we even begin this conversation?
I think we begin this conversation by doing things like we're doing today and destigmatizing. I've been there when they talked about when someone look at you and say, suck it up. I worked as a paramedic over 25 years ago, significant incident, and I thought I could lean on the men that I worked on, because that time, primarily, the paramedics around me were men. But the response I got was, suck it up. And thought through, and again, I think today we got to be able to have conversations, difficulty as it is, to make other men feel comfortable that it is okay to not be okay. And I know it might sound like a cliche, but it's okay not to be okay. And check in on people. I want to say to this day, I have good friends. I have coworkers that sometimes just reach out, are you okay? Could be a text message, phone call. That goes a long way. So I think we'd break down that stigma and make it comfortable that we could sit down and have a coffee and have a conversation. Just same as we talk about, I got diagnosed with diabetes last week, let's talk about it. That I got diagnosed with a mental health injury, let's talk about it. And I think we ought to take those steps to get there. That, and I know we've made progress, but even today when I look at it, there's an expectation, wait now, this person that's in a certain role is actually talking about mental health. Some still look at that today as a weakness, and that's most unfortunate. I don't see it as a weakness, I think it's a strength.
I want to talk more about stigma and discrimination in a second, but I do want to go back a little bit to talk more about what mental health looks like in men that maybe sets it apart from other people. Nathan, you talked there about sometimes it's anger, it's frustration, it's aggression, or whatever it is. Talk more about what you're seeing in terms of outward behaviors and symptoms, if you will, of a man who is in a mental health issue or having mental health issues now that maybe may not resonate with everybody on the front. For example, I use depression as an example. Depression means you're sad. Not necessarily. I mean, it can come out of a whole host of other things. How does it look in terms of then from men's perspectives?
Well, I guess similar to what Bill was talking about earlier, I guess about the kind of extremes that we have when it comes to the continuum about mental health experience. We have a man that will say, I'm fine, everything is okay. And then we have like a man who can experience more of those like outward symptoms as externalization around like frustration and irritation. And sometimes when we fall in the middle, it can become very confusing about what we are experiencing. And they often said risk-taking behavior is a big one. Men that are experiencing mental health issues will more likely take risk. I've done screeners when it comes to depression, and that is not there. So we don't talk about those things when it comes to men's mental health, and it looks significantly different in men.
Full disclosure, about 10 years ago, I returned to this province. It was a major life change for me, and some things had happened in my past. And I came back, and I was furious at the world. People who were nice to me, step aside because it's not going to go well. It was one of the, and that was not who I was. But it took me several years to realize, and after many conversations, that I was angry, but the underlying cause was absolute depression. And then my life changed. But let me tell you, and even somebody with a background in psychology that I had before I became a journalist, those were big steps to take, to admit that there was a flaw there, to admit that you needed the help. That's a hard one, right? Talking more about then the stigma and that sense, whether it's real or perceived, how much does that factor into conversations that you have with clients and with people in your daily life, Bill? I mean, how much of an obstacle is stigma even in 2026?
Stigma is still a huge problem. There's no doubt about that. But going back to the previous question for a second, when we say, what does mental health look like in men. And, anger is the hallmark of male depression, which clearly you found out as we went through. Some of us will have to find it out the harder way. But we don't talk about that a whole lot. And what, mental illness and mental health problems actually look like in a lot of men is being exhausted, right? Being tired, right? Not able to function, right? These physical symptoms is what people come in, and very rare does someone come in and say, I'm depressed. They're not recognizing it. They're not seeing what's actually happening. So you have to listen to the language, and you mentioned the emotional literacy earlier. We're not very literate because, you know what? I know when I got a broken leg. I know when I got a busted arm. I got a headache. I mightn't recognize that it's a mental health issue. I might be stressed. I might be burnt out. Right? These are also mental health issues, and that's how it presents a lot of times in men. Right? We're not recognizing it ourselves. We haven't done a great job in the education side of that, so we can recognize what that looks like. But in ourselves as men, we don't necessarily associate getting mental health help with being stressed out at work.
Yeah, that's a very good point.
So the stigma side is still very large. I was talking to a young man the other night, and he said mental health doesn't exist in construction. Right? And I remember back when I worked road construction back when I was a teenager. And not sure how much has changed since, but according to this kid, not a whole lot. So stigma is still a huge part, especially in some of the male-dominated areas. Society. Men are, for me, men that come in are less worried about what other people think, and they're more concerned about judging themselves. So I look at stigma. Yes, we got a lot of work to do on the societal part. We still got a lot of barriers to knock down. It's still causing a lot of grief, but when it comes to men specifically, it's a self-stigma. We're our own worst enemies. You're not going to treat me any worse than I treat myself. Right? When I fail, when I don't live up to the expectation I set for myself, when I perceive I've got a shortcoming, right? I'm going to create the whip for my own arse. I don't need you. Right? And that negative self-talk in itself can drive you into depression. Right? So for me, when it comes to stigma, yes, society has a lot of work to do, but as men, as individuals, getting connected, having some belonging, keeping your purpose, understanding that we're all humans. Right? We do make mistakes, and it's okay. This is where we start to fall down, because we are literally beating the heck out of ourselves when it comes to stigma. And I always say to guys, it's when you go into depression, it's kind of like, you got an angel on one side and a devil on the other. Depression's kind of like having two devils. And all day long, you're a loser, and you don't measure up. And that guy got a new house, and you can't afford this. All day long, every day. What kind of impact do you think that has on your mental health as you go along? And that's yourself doing that. So stigma is a big problem all around, but the self-stigma is something that we really got to get a handle on when it comes to men. And again, some of that comes from the socialization, the expectations we have on what it means to be a man these days. Right? We need to redefine what it means to be a man. We need to redefine what strength is.
Jerry, when we look at the workforce, I work for a company that has an employee assistance program, and it's a wonderful program. You have worked in frontline jobs. You were a paramedic previously as well. And you talk to people all the time who work jobs that most of us could not handle in terms of the things you see and the baggage you take home with you. There is also interviews that I have done, for example, with people who work those jobs that say, I need help, but I don't want people in the workplace to know that I need help. So how do you overcome that obstacle to say, hey, there are resources here, but I don't want people to think that I am lesser than or weaker than or whatever idea that they're putting in their head in the workplace to think that I can't continue to do this job?
Yeah, and that's a significant challenge. You look across a number of professions, and myself and a colleague just came back from actually a first responder mental health conference, and that's a big issue, especially around first responders, because when you look at most first responders, they're expected to be the individuals that's going to be there to help everybody else. But most often, they need help. And when you look at it, a lot are afraid, fearful of confidentiality, what will be said if they go to seek help. But the assurance have to be that, look, you will be treated no differently than, like Bill alluded to earlier, like if I stood into a room with a broken arm or a cast on my leg, people would come up and ask me, am I doing okay? You can see I have a physical injury. But there's many in these, especially these professions, or in many, but that have injuries, that want to seek help. And like I said, we got to get past where they should feel comfortable enough that they would be able to approach their employer or coworkers. But again, confidentiality is a big thing. Some people want to know that they can seek out help and it'll be strictly confidential. But we got to get, again, to a point where people understand, there are people that are sustained, especially when I'm talking about specifically mental health injury because their work, that they feel comfortable enough that they can go forward and talk about it. And I said, I'll harken back, you mentioned me being a paramedic. We got to get past where somebody look at you, suck it up, it's part of the job. It is not a normal part of the job. And you got to be able to reach out. Like I said, great to have EFAP programs out, but what we have found, and not just again speak to our organization, is that the supports are not there in some cases that need to be there. They're not as accessible as they should be. And so still work to be done, but like I said, it's significantly challenging.
Nathan, Bill talked there and sort of referenced this idea of restructuring what masculinity is and what the definition of being a man is. I mean, those are some big conversations to have too. Where do we start to have that conversation to reframe what masculinity is? Because I think back to your crayon analogy too. There are many shades to that box, right? So where do we begin?
Is the answer just everywhere? Like, I just think, we start in the communities, we start in the workplaces. We want to reach out to people and acknowledge that, redefining masculinity. And I guess to extend on that, especially being vulnerable, redefining that type A, personalities, keeping to yourself, working hard, putting your head down, pushing forward, not reaching out to people, keeping to yourself, keeping everything, on your shoulders, not getting that support. It's okay to get that support. And kind of like what Jerry said earlier, it's okay to also not be okay. And being vulnerable and admitting that you need help is just also part of being a man.
And we have to acknowledge here that racialized communities are disproportionately affected by mental health issues and by a lack of access to resources as well. So that has to factor into this conversation as well. So how do we approach that? I mean, is this at the community level that we do this to ensure that that all people are covered and taken care of properly, Bill?
Yeah, that's a great start. I think the conversation has to start in childhood when it comes to what it means to be a man. Right? When that kid falls down, you got a choice. Right? He falls down, he starts crying. Are you going to tell him that his emotions matter? Or are you going to tell him that his emotions don't really matter? Right? It starts back then. So all of us have a role to play. Again, you go through the paradigm of life, and there's different approaches for each different age group and different needs. But when we talk about how we're going to redefine what it means to be a man, we got to start all the way back in childhood. Right? We're not even in the high schools yet. I do a Be a Man program that I go into the high schools and I meet with some of the graduating seniors, and I'm just shocked when I talk to them and I say, "What does it mean to be a man?" Right? And I'll get be competitive, be strong. One kid actually said in the first session I did, beating up other kids is what it meant to be a man. Right? Same kind of mantras we had 30 years ago, I guess. So we got a lot of work to do. We're not even at that stage yet. We need to bring it all the way back, redefining what strength is.
I want to dig deeper into that in a minute. Yeah. I do want to talk a little bit about maybe broadening the scope here. We're talking about the individual, a man who was looking for mental health help. If we widen the scope here and we look at the families and the social networks that they are part of, what kind of trickle-down effect does it have on the communities and the families and those social networks when a man is struggling and doesn't really know where to look for answers and help? Jerry, we'll start with you.
It certainly does have a trickle-down effect, and I think it can be clearly seen in some areas, like the impact on families, communities, the impact on the person where they may work, on their co-workers. Like the trickle-down effect is clearly obvious, and I think it's a clear indication that we have a problem and one that needs to be addressed.
I mean, Nathan, I'm of a generation now where my kids would be going to university. I don't have any kids, thank God. That's another panel discussion, I think. But I'm also of a generation where you didn't talk about your feelings. You certainly didn't admit that you were having troubles. So if I'm raising children and then passing that on to another generation, how do we break that cycle? Because they're only teaching kids what they know themselves. How do you break that?
I can start. Well, I guess, again, what we're doing today, creating space, creating opportunities for people to speak up and talk about what's really on their mind. I guess talking about like a program called the Buddy Up is around men's mental health and suicide prevention, where men are reaching out to their buddies, checking in, asking the hard questions. Like Bill said earlier, often if a friend will ask me, "Are you okay?" I'll say, "I'm fine." What's really on your mind, Ethan? What's really bugging you? You don't seem like yourself today. We gotta, learn how to ask each other those questions, because at surface level, we're all fine. We gotta dig deeper, create space for men to open up and be vulnerable with each other.
And the trickle down effect, the mistake that we've made when it comes to men's mental health is thinking that it's just a men's issue. Right? It's not. Right. When it comes to men's mental health, when the man is struggling, if he's going through a lot, if he's stressed, if he's burnt out, everybody in the house is struggling along with him. People in the workplace are noticing. People in the hockey teams are noticing. Right. The trickle down effect, it affects the partners, it affects the parents, it affects the kids, and the kids are very perceptive. So they might know that dad is going through depression. They might know that dad is stressed at work. Right? They might know what's going on, but they can feel something different. And then they start to internalize, did I do something? Is it me? Dad's really irritable. Right? I must have done something wrong. The trickle-down effect, it affects our entire communities. Right? It affects road rage. It affects the hockey rinks. Right? The way we start to approach this, you've asked earlier, do we start at the community level? Absolutely. Right? We're bringing in men's sheds into the province now. Right? So men have a sense of connection, a sense of belonging, a sense of purpose, right? We need more programs that bring men together to get them connected. Listen, men don't need to be fixed, right? I'll say that again. Men don't need to be fixed. We're not broken, right? We need to be connected, and we're not. We're all islands unto ourselves. We need to bridge that connection and understand that bridging that connection, giving men a purpose, giving them some belonging, giving them the supports that we need. That doesn't have to start in the clinic. It doesn't have to start with a counselor. It might start in a shed. It might start at a coffee at Tim Hortons. Right? It might start at the water cooler at work. Right? But making it okay and normalizing these types of conversations is where we need to be. But make no mistake, men's mental health is a societal issue that affects every single one of us out here. And it's going to take all of us to fix it.
How often do you see men and spouses or families come in to talk to you as a group therapy sort of setting? How important would that be?
You know what I see more? I see guys coming in because they've run into a tremendous difficulty in their life. Again, things have to be pretty severe for a lot of guys to come in. The other piece that I get a lot of is I get guys referred to me from marriage counseling, because they'll go to marriage counseling trying to work on the relationship, but if the guy is severely depressed, if he's having mental health issues, he's got a lot of stuff to deal with on his own, he's not in the mindset for marriage counseling. He's not in the mindset to work on the relationship, right? Everything might seem like an attack, right? Everything's going to seem like it's his fault. So I get a lot of guys that are referred to me from other counselors. Can you see so-and-so, the man? I'm going to deal with the wife. Can you work with the man and see if we can get these guys to a point where they can get back and work on marriage counseling? So not as much of the two coming in, the marriage counseling side, the male that has things to work on that he hasn't realized, but it might have got highlighted in a marriage counseling session where the counselor might have said, you know what, you need to go work on yourself a little bit, and then we'll revisit it.
And you touched on something, Bill, that I thought was interesting there, that you have to get to a point when you feel that you are worthy and deserving of help at the same time, because I think maybe a lot of men don't necessarily feel that. How do you overcome that? Feel free, anybody, to jump in.
Well, you overcome that through self-reflection, right? Through some reframing, from going in, getting another perspective from somebody, from being in a safe environment where you can have these conversations, or you can also get that from a men's shed, or from a program that can bring men together where they can do an activity shoulder to shoulder, have less pressure, and men a lot of guys seek connection more than before they seek counseling, right? They before they become vulnerable, they need to have trust. So getting guys together to do a shared activity, to come to a men's shed, to do a project together, to go out and be in service in the community, to put a ramp on a senior's home. It's amazing when you get guys together and get them connected, the conversations can start. Once the conversations start, then they realize, you know what, I'm not alone. It's not just me. I'm not broken. It's not just a me thing. And that's really empowering. So what we need to do is get guys connected across the province, in the communities. And we talked about isolation stuff earlier, and the urban and rural area comes up a lot, right? Both have their drawbacks. You got the rural areas, limited access to services, transportation, privacy issues. But you can also be in the city surrounded by 500,000 people and feel absolutely alone, right? Because the loneliness epidemic that we have going right now, it's not about being alone, it's not being connected to people that are next to you. So we need to bridge that with our community services and start to invest in our communities and in programs that are going to bring guys together, move out of the crisis mode, because right now we have supports available to men, a lot of crisis management pieces. We don't do a very good job on prevention, and that's where we need to shift this focus.
Jerry, earlier you mentioned that sort of suck it up mentality, that if you have a problem, just deal with it and get on with it and move on. And I think there's a lot of sympathy, as you said also earlier, if you fall down and broke your leg, you'd have a cast on it, you'd have a whole team of medical people helping you out. But if you suddenly break into tears in the middle of a room or a dinner party, nobody really knows what to do, right? How do you overcome that? In other words, to surround yourself by people who are okay with you saying, I need some help here, without sort of feeling like now we have to treat this person like they're made from glass.
And I think, again, it goes back to have those open conversations, realizing that this can happen and letting people know that it's okay. Look, be there to support that person. Understand, or don't be afraid to ask them, are you okay? Have that conversation with them, because it happens. Been there and seen it happen. Like I said, and again, in some professions that we deal with, it's not uncommon when we've had conversations or sessions, you'll see somebody actually break down, somebody actually leave a room. But it's okay, like I said, have that conversation with them. But again, destigmatize it. Like, have these conversations, normalize it, that, yeah, that person is having some event, some issue. It's okay to talk to them, recognize them, because like I said, that old issue around this stigma is really problematic.
It's interesting, because if the support system doesn't know how to support you properly, then there's no support, right? And Nathan, you talked there about sort of sitting around with, with a group of your buddies instead of, really sort of digging into the. I know there are people watching this live stream or maybe in this room right now that've been like, that's never ever going to happen while we're out doing a boil up in the middle of the woods or something like that. How do you get past that part of it? Because if the support system that you're hoping to rely on is also not really quite in tune with how to really provide that support, how do you get past that obstacle? Because you're going to learn over time to stop asking. Right?
Yeah, definitely. Reaching out, talking about the hard stuff. I kind of just say, try to embrace the awkward. We have to embrace being uncomfortable, because when we are uncomfortable is when we can grow. If we stay in our shells, things will just continue as they are. But when we can reach out, get uncomfortable, open up these conversations, that's when real growth can happen and kind of like what Bill said, men being side by side, doing something together, working towards a goal, that is when these types of conversations are going to open up. I guess in like therapy to kind of like talk about what's like call it doorknob drop. You're in session, you're going through it with the client, and you're like, okay, we're ending the session now. The client like is basically hand on the door. Oh, by the way, this big thing happened. I gotta go. Bye. And then you're just sat there. I gotta take note and bring this up next time.
Because they wanted to tell you about it, but they wanted to tell you and then bolt. And so then it's your responsibility then, obviously, then to pick up that conversation.
Yeah.
Jerry, there are certainly resources available in this province. Some are sort of entry level, foot in the door, single sessions. Some are a bit more sort of long term and a bit deeper. But there are often wait times and there are hurdles even to get access to those too. Is enough being done in this province right now to provide mental health supports for men specifically?
Short answer is no. I think more can be done. Have we progressed and came further than previously? Yes. When I look at things that I've seen Bill personally do, I think we need to see more of that. We need to see more support in place. Like, as a support, like I've attended a couple of things that Bill have had in the past, and I've seen the benefit that it provides, but there's not enough support there for it. And like I said, the short answer is no. I believe there's a whole host of things that can be done, and it's not all about monetary piece. That's a piece of it. But ensuring that the supports are recognized, they're put in place, and that support is given. Like I said, not because Bill is here, but like I said, I've seen some of the things that Bill have done, and as a support, attended those, and actually I don't want to say walked away, benefited myself from being there. But I think we need to do more of that. We need to be supportive when we see these things happening. I think we need employers and governments, community organizations and unions stepping up and doing a lot more. So, like I say, I don't think it's there. We're moving in the right direction, but still work needs to be done.
Bill, we talked briefly earlier about conversations that need to happen now in terms of men and young people as well. Let's revisit that for a little bit more. What kind of conversations should we be having now at the family level? And how early should we be having those conversations to make sure that we are planting those seeds then for young people, young boys especially, to be able to understand and fully appreciate their own mental health? And is it too early in age?
No, it's definitely not too early in age. When it comes to the young kids, young boys these days, they're learning more what the male role models in their life are doing. They're learning from what they're doing more so than what they're saying. They're watching us. Right? They're watching if we're getting help when we're struggling, if we're having emotions, if we're saying it's okay to have problems. It brings me back to when I was coaching baseball, and again we talk about how ingrained all this socialization is to us. Right? It's ingrained in us. And I was coaching my son playing baseball about, 10 years ago, and he got hit by a pitch. So coach/dad pops out of the dugout and goes out to him. Right? And now I've been researching this, and I've been working it, and I've been studying it. And what do you think the first thing that came out of my face was? Right? And don't go crying. And I got myself, oh my God. And I couldn't put the words back in. So I caught myself and said, "Oh, it's okay. Take a knee. I mean, somebody's throwing an object at you that bangs you on the wrist. Probably hurts a little bit, right? Take a knee. It's okay." But the damage was already done. And so he took a second, and he went on down to first base with tears in his eyes. And I went back to the dugout with tears in mine. So no, it's never too young to have these conversations. The kids are watching what we're doing. There's so many different ways that we can adjust the perception and how we're handling ourselves. One of the biggest things we need to do, and to go to Nathan's conversation with opening up with our group of buddies, we need to have bigger campaigns where we make it okay. Yes, it's okay to not be okay. We got to move past the slogans now. All right, we need to have billboards, we need to have buses, we need to change the messaging to help these conversations. We're just expecting guys are going to get in groups, about themselves, and I've known these guys for 20 years, and suddenly we're going to be different amongst each other. That's not how this always works. Right? We need to change the messaging. We need to change how society is dictating what's going on. It starts in the home. It starts in the schools. It starts in community centers. There's teachers. There's coaches. Everybody needs to be on board with teaching the young fellows a different way of interacting. The problem is, like, I had an event last summer. It was yoga and breath work in the park, and I was talking to a younger guy that came there. He's probably mid-20s or so, and he was telling me how he almost didn't come to the event because he told his dad what it was, and his dad was making fun of it. And that really, struck a chord with me, and it's something that hadn't dawned on me. We're trying to adjust what we're doing. We're trying to redefine masculinity. We're trying to make things better. However, we don't change some of the messaging. Some of these kids are getting conflicting messages because dad is still at home. Dad is still the same way he was always brought up. Right? He's the competitive and strong, keep stuff to yourself, sweep it under the rug type of guy. And so here's the young fellow wanting to come out, get connection, have a sense of belonging, take part in an activity with other guys. Meanwhile, he's getting shamed for it at home by his own dad. So there's no simple solution to this, but we need a coordinated effort. We need to have media campaigns. We need to have the messaging everywhere that guys can pick it up as they're driving along. We need to plant these seeds. And so far, we haven't had a great effort in doing that. But going forward, if we want to make change in our men and our boys and in the men's mental health field, we need to start doing a better job.
Nathan, how do we ensure that those conversations, though, are quality rather than quantity? Because we do have a tendency, especially younger generations too, to really talk a lot about our mental health, but at a very surface level. How do we make sure that we dig deeper and have something that's actually of purpose and worth?
And that is truly important because we do need, people like, I guess, the four of us up here that are kind of knowledgeable, aware of certain languages and understanding that men have in lived experiences. Part of my position at CMHA is creating awareness in the community. I'm going to be designing programs, presentations where I can go into the community, go into a workplace, a men-populated workplace, and talk about emotional awareness, mental health, what that can look like in the day-to-day life of man. How to talk about it. Have some activities that they can take away, to have a tangible goal for themselves to move towards. So it's just creating more awareness and having people who are committed to the goal, people who are committed to the project, create more awareness for men. We just need more people like us.
It's frustrating at times because we can have all of these conversations and leave this room feeling really empowered, but then you have just one comment from a loved one or somebody on the street that just whips the feet right out from under you as well, right? So there is that struggle that we always have to keep that messaging on brand, right? But it is very, very easy to get derailed. Jerry, when it comes to employers and unions specifically, what kind of role do they have right now in making sure that we have constructive conversations, but also supportive workplaces too?
I think collectively we have a role to work collaboratively to make a difference. Like I said, these conversations one thing, but I think when we look at employers, whether that be government as an employer, whether that be a large employer like NLHS or private employer like where the occurrence was the weekend, and unions, not just NAPE. We have a responsibility where I believe if we work together that we can certainly make a difference, but we have to make sure that we provide the spaces, we provide the resources, access to the resources, and the knowledge that the resources exist, because I still can't believe that in even recent years with a significant group that, and I'll just again use our example, a significant group that we represent, providing, in this case, emergency medical services, did not know what resources were available to them from their own employer. So a piece of work has been done around that. So what we got to continue chipping away, doing those pieces, because look, if we make a difference for one person, we've made a difference. But I think everybody, we had to work collaboratively. This is not on an employer alone. This is not on NAPE alone. This is not on a government alone. I think if we all look at this and take a team approach to it, a collaborative approach, we can make a significant difference.
Nathan, as a counselor on the front lines, if you could have a conversation with a decision maker, it's not about money, like all about money, like Jerry said, but it certainly helps when it comes to providing programming and supports. What would you like to say to a decision maker right now that you would like to see starting immediately in this province to help you and your clients, for example?
Just more opportunities for men to get together. You know, we need people out there doing like men's mental health groups, doing like men's walk and talks, you know, more like men's sheds, and more opportunities for men to get together. How can we get that like rolling? You know, part of like the CMHA for me and my focus is to bring men together. But that can come with a lot of nervousness, a lot of anxiety. So how can we like break down these barriers so it's less anxiety inducing and easily accessible for men to access these supports?
Yeah. Bill, what would you like to see?
Well, you know, the men's sheds is a great idea. We had a program going last summer that was really doing well, and that got cut, which we can have a conversation about a different time, but that was really rolling along. You know, we need to have more mentoring opportunities. We need to bring some of the older generation together with the younger generation, right? We need to have, because there's learnings on both sides of that. We need to invest heavily in the community level, in the prevention side of things. If we want to make changes with men's mental health going forward, we have to start on the community level with our investment. Again, it doesn't start with Nathan and myself as counselors for a lot of guys. The conversation might start with some connection before that. Guys are willing to come out and have these activities. They are willing to come out and be part of a men's sheds. They are willing to congregate. So as a society and as a province, is, you know, really up to us to make sure we create these spaces for guys to come out and do that. Right? We see where we want to go. We know the societal issues that we're trying to address. We have evidence that guys will come out and take part in shoulder-to-shoulder activities, have these deep, meaningful discussions if we provide them the opportunity to do that. I think the road is pretty clear that we need to start doing more of that, if that's what we want to have happen.
Yeah. Jerry, you get the last word here. I want to get an answer of that question from you, too. You sometimes have the ear of decision makers in this province. What would you like to tell them, or what have you told them already that you'd like to see?
What I keep repeatedly saying is that listening is one thing, but acting. Like I said, we continue to advocate in a number of areas. Our members in our province, actually a number of the people that provide these services are our members. So one thing I'd say to decision makers is, like, say, take actions that people can see the results of. And I know we say funding, and I often say, well, money's not part of the issue, but like I said, when Bill talks about a program that he had cut, that was part of it, that was a decision, something that was have a positive impact. So again, I think we had to revisit some of those things that are being impactful. Why are we eliminating them? And they clearly make a difference. So like the decision makers, like say, revisit some things and look at decisions you make, and did you make the right decision? There's nothing wrong with admitting sometimes I made the wrong decision, let's fix that.
I just want to leave everybody here today and those on the live stream with some statistics to sort of just really hammer home the situation that we are talking about here. And then I will say thank you to everybody here. But Canadian Mental Health Association, Stats Canada reported in 2022 that males were 3 times more likely to die by suicide than females. And the Mental Health Commission of Canada noted that close to 75% of deaths by suicide in Canada were men. Earlier, we talked about that 2,000 men survey done by the Canadian Men's Health Foundation back in 2025, where 67%, I just want to hit that number again, admitted never, ever seeking out mental health supports. And the State of Mental Health in Canada, that 2024 report, that did an overview of the country and then really sort of dug down into the provinces, province by province. They said that Canadians' mental health 3 times worse than it was before the pandemic, that 2.5 million people really can't get the care that they need. In Newfoundland and Labrador, self-ratings of poor and fair mental health are the highest in this province at 30%. And the provincial suicide rates, while on par with the national average, the differences come when you focus on racialized populations and gender categories. And men outnumber women in that regard too. I mean, these are sobering stats.
And also, if you look at 2020, 2021, our own province, we're, I think, 80, 82%. So, we're above average.
Yeah. And on that sobering thought, I just want to say thank you to all 3 of you for coming out here and having this conversation. This is a very introductory conversation into mental health, and specifically men's mental health in this province. In about an hour or so, we just start to scratch the surface, but it's an important surface to scratch, I think. So, Jerry Earle, thank you very much, sir. Thank you to Nathan Jenkins, and thank you to Bill as well, Bill Jeffrey. I appreciate all of your insights and your candor here today. Thank you very, very much. Thank you to NAPE as well for hosting this panel discussion. Thank you to everybody in attendance today, and thank you to everybody on the live stream as well. Thank you so much.
Thank you.
Okay.
And now we leave. And now we awkwardly say, there's theme music.
He's got a family, kids and a wife. Oh, he's got a good job, he's living the life. But he's got a secret, and he's got a plan. Nobody knows yet, but he's the lonely man. When he was young, hard as a rock, he was all action, no time for talk. He worked hard, he played hard, hell, he had to win. And he was told to be tough again and again. And now the lonely man doesn't tell you how he's feeling. The lonely man, he just hides his pain. The lonely man, inside he's reeling. He pretends the sunshine in the rain. These days when he's at home, well, he's always mad. And even when he is there, his kids miss Dad. 'Cause he needs to talk now, but who would he talk to? He loves her so much, but that's something he can't do. He spends his nights alone in a bar, or spinning old tunes, sitting in his car. Sometimes when he's in bed and he'll start to yawn, she's laying next to him wondering where's he really gone. Because the lonely man doesn't tell you how he's feeling. The lonely man, he just hides his pain. The lonely man, inside he's reeling. He pretends there's sunshine in the rain. He's gotten older, but but he's not the same. He's the latest player in this tired game. He once was a warrior, but he's feeling done. Inside his mind, his world weighs a ton. And he's full of guilt now, oh, he's full of shame. And he hears the silence when no one calls his name. He feels real numb, but his heart is sore. Pretty soon that lonely man won't be lonely anymore. Because the lonely man doesn't tell you how he's feeling. The lonely man, he just hides his pain. The lonely man, inside he's reeling. He just found some sunshine in his rain. He just found some sunshine in his rain.